Good evening. Can you hear me okay?
Yep.
Yeah, it's close enough. So thank you, Layla, for the introduction. I'd also like to say thank you to our lovely hosts for the invitation to come speak to you tonight. It's a privilege. So this evening I'd like to speak to you about 3 different groups of people. The first is my team. So I work with a team of 20 healthcare professionals who every day come in with joyful hearts to work with our patients who've been diagnosed with cancer. I work with an interprofessional team of various disciplines, so speech-language therapists, psychologists, psychiatrists, dietitians, physiotherapists, occupational therapists. I don't want to miss anyone. They're not here, but somehow if they find out I miss them. And social workers. And together we look after a great proportion of the patients who come into our center. We provide support and rehabilitation, physically and emotional support. One of the greater things that we do is around navigating the healthcare system. So for a lot of people, when they come in, not only have they been diagnosed, but they actually don't know who they're going to meet, how it's all going to happen. They're obviously very scared, very afraid. So it's part of our work to orient them, to make sure that they know what's going to happen, to have a sense of control, a sense that they can predict the sequence of events for them. We also work very closely with the nurses and physicians who provide the chemotherapy and the radiation therapy that all of these patients need. So the next group of persons that I want to talk to you about are the actual patients. We look after hundreds, thousands of patients every year, and what they have to go through is very, very difficult. And I'm sure everyone has met somebody that's been affected with this. In some cases, it's actually relatively simple. They go through, they are diagnosed, and some of their physicians actually speak to them about having cured their cancer, which is fantastic. It gives them a lot of hope, and we provide them with a lot of support in terms of survivorship when they get back into their regular lives, going back to work, and what we call the new normal. For others, it's not so simple. For others, it's far more complex. And for those, they end up having to do this every day for years. They come to our center. The third group of persons that I want to talk to you about tonight are some of the patients who go through the ordeal that I've just described to you, but in addition to having to cope with their diagnosis and the grueling treatments that they normally have to go through, they can't afford to be sick. We know that in Canada, if someone is diagnosed with cancer, their household income will drop by 30% that year that they've been diagnosed, for a multitude of reasons. They can't work as much as they were working before. If there are income replacement programs in place, either privately or through the state, federal, or provincial governments, it's very much reduced to what they're usually used to in terms of an income. And so when we get to meet them, often they don't actually want our help. They don't want financial assistance from us. We have what's called the Patient Emergency Needs Fund. And that's part of why you're here tonight, is to raise money for that fund. And we help with very basic needs. We have sort of guidelines we use and a process to be able to access those funds. And so we do a financial assessment along with everything else, functional assessment, emotional assessment. We look at everything of what's going on for them. And as I said before, they are very proud, and they've been vigilant and diligent with their monies and their families for years. And they get to a point where often by the time we meet them, it's actually because they're depressed. It's actually because they've been struggling for months and years, and they've had family support. that is exhausted. And they're referred to us because their mood is low, and by the physicians or the nurses. And sure enough, we start looking at or assessing their needs, and we realize that the mood is related to the fact that they've been in financial difficulties for months, sometimes years. And so it's at that point that we're able to help. As I said earlier, it's usually with very basic needs, things like petrol for their vehicle or food on their table. We rarely get anything that's exaggerated, or it's always appropriate, and it's always in a desperate, desperate need. So it's our privilege to be able to be stewards of those funds and to be able to help these people. And they're very, very grateful. It's actually very touching when they do accept our help and they walk out of the clinic for the first time in months sometimes, where they can actually afford the parking, where they don't have to put it on their credit card. So, and this is why you're here tonight, to be able to contribute to that. I think it's a fantastic idea. I obviously support it. And in order to give you a bit of an inspiration as I leave you, whenever I meet new people, or I go to a dinner party, or people ask me, so what do you do? And I say to them, I'm a social worker. And they say, oh yeah. And they ask me where, and I tell them where. And they say, 90% of the time they'll say, oh, I couldn't do what you do. And it always makes me smile, because what I do is I see courageous, determined people go through extraordinary circumstances every day. So when I go home at night, I'm inspired and I'm grateful. So, thanks to you.